those of you here that think that there are not death panels are mistaken. There are. They just happen to work for insurance companies. I think that a lot of people have heard about stories of people who've been cut off from their care, and you know, when they have life-threatening diseases and so forth. So I'm not going to go over that. I just want to say that my mother, in the last 5 years, had a stroke. And if it had not been for me fighting for her, the insurance company and HMO would have cut her off from life-saving and not extraordinary life-saving treatment shortly after her stroke. The question that I have is, we are self-employed. Do we also get help from this bill as a small business?
There are two. The answer could be yes. I don't know your circumstances, but you could qualify under two ways. One, under the tax credit that I alluded to for small businesses of less than 25 employees. There are tax credits that you might qualify for. The other provision would be based on your income. If you are under 400% of the poverty line, that's about $88,000, then you would be entitled on a sliding scale to a subsidy so that you would never have to be more than 12% of your net income for, I think maybe gross income, I may be wrong on that, for your premiums. So there are two provisions that may or may not help you depending on your circumstances. And I think that could be significant.
First of all, plenty of other things have been lost rather than the 10,000 a day that lost health care. Why aren't we doing more in that regard? Also, why have health care costs doubled? Does that include Medicare, Medicaid, and the illegal aliens? And what about tort reform? And what about... we just reject this healthcare reform. It's not saying that we're against healthcare reform, but it's the type of healthcare reform that we have. What about health savings accounts? Why is everything a crisis when 80% of Americans are happy with their insurance coverage? So much intrusion of government into the why access to our bank accounts?
Well, you managed to get 14 and a half questions in there, so I'm going to let me start with the privacy issue. We were in Kitsap County, had a meeting in Kitsap County yesterday, and quite a number of people brought up a privacy issue. They felt that their privacy was jeopardized by this bill. And I can tell you, I've looked at this bill very, very carefully. I spent, 40 or 60 hours in the markup. Markup is where you amend the bill in the Commerce Committee that I served on. I've talked about it. I have been a privacy advocate, probably with more vigor than anybody in the U.S. Congress. I'll give you an example of that. When you sent me to Congress in 1999, I got a letter from a guy in Kitsap County that said his bank was going to sell his checking account records to telemarketers so they could telemarket back to him the products. And because of my work, because you sent me there, because of my work, we passed a bill that prohibited that behavior, so your banks can no longer sell your checking account record to telemarketers. I point that out because this is a really big deal to me personally, to not allow privacy violations. Now, it will not surprise you to know there are people that are opposed to health care reform in this country. Some of them are multi-billion-dollar industries that don't like the fact that they may not be able some of these folks, on occasion, this may shock you, have said things that aren't true about the bill. Well, we had a governor up in Alaska trying to tell people there's death panels in the bill, for goodness sake. What are you talking about? people trying to tell people that Uncle Sam's going to go to everybody's bank account here and intrude their privacy. That is not accurate. I have read the bill. It is not in the bill. So what there is in the bill, there is a provision that if you are a low-income individual, and if you seek one of these subsidies that I talked about, if you're below 400% of poverty, and you apply to Uncle Sam for government subsidy for your premium, the government can look at your tax return to see whether in fact you're telling the truth or not. Now, the government already has your tax return, frankly, so I don't think that's a big deal at all. So I will tell you, I appreciate your interest in your privacy. Together, they find ways to do medically effective things to reduce costs, so they're not doing things that are not medically necessary. So once these doctors work together, they can establish their own standard of care. That's not bureaucrats, the doctors themselves, deciding the standard of care so they have less worry. But there are two other reasons. It's not in the bill. Number one, what we have found is that states that have taken away the right of citizens to have access to a jury, because that's what tort reform is, it basically takes away the right to a jury trial. States that have tried to do this have simply found that it is ineffective. If you take a look at this, chart here, and I lost my pointer here, if you go back to take a look at the chart on our costs, if I can find my magic pointer here, Seattle, 7,000. McAllen, Texas, $14,500. Since they passed tort reform, since they essentially severely reduced the citizens' right to compensation, their costs have gone up dramatically, and they have found it simply has not been successful. Now, if you don't trust me, because I'm only one person, go look on the website at the multiple studies about this from the Congressional Budget Office, which is a nonpartisan, not Democrat, not Republican, the General Accounting Office, which is nonpartisan, not Republican, not Democrat, the Office of Technology. All of them have studied this and basically found it just has not succeeded. That's the second reason. The third reason is fundamental to what you believe is the right way to determine justice. And people will have different views on this. I will just express my view. And I'll tell you a little story on why I believe this. There's one of our neighbors lives in King County, went in for routine screening mammography about 8 years ago, found a cyst, had a biopsy came back malignant, went in, had a radical mastectomy. She then developed a blood clot in her leg and got gangrene in her leg, and they had to cut off her leg at the hip. That gangrene spread into her abdomen, and they had to cut out her bowel, and she now has a colostomy basically for the rest of her life. So she had a radical mastectomy, had her leg cut off at the hip, and is missing 75–80% of her bowel. They then found out that there had been a huge error that everybody agreed was a massive error, was negligence. She never had a malignant tumor. It was benign. She didn't have to have any of those procedures. So here we have a woman who suffered pretty grievously. So here's the question in our society. Who decides what is justice in that most difficult situation? Today, the people who decide are in this room. Everybody in the bleachers and on the front, and not the member of the U.S. Congress, not the Senate, not the Congress. Because we don't know the facts of this situation. I don't know that lady, what she's gone through. We leave it to the most democratic process in America, which are 12 people picked randomly in a jury that make a decision. And I believe I know some senators and congressmen, some of them are real smart and they're dedicated, but I don't trust them more than I trust 12 citizens who are picked randomly. That's where I come out on this